So thank you very much for the chance to do a little update. What I thought I'd do is walk through the presentation I did at the National Forum in November, held in Ottawa. This is an annual event by the National Farm Animal Health and Welfare Council. We typically get 100 to 150 people from industry, government, and some of the service industries involved in farm animal health and welfare, such as veterinarians and so on. I gave an update on the developments in farm animal welfare, and if we go to the next slide, Christy, just to remind ourselves that farm animal welfare involves a huge number of players, producers and their associations, farm staff, veterinarians, transporters, auction staff, processors, slaughter plant workers, retailers, regulators, scientists, and governments. And there is no top-down system for coordinating actions among these diverse players. What we have to do is create horizontal ways of coordinating actions to achieve good outcomes. So I think that's the challenge. In the next slide, what I'm proposing here is that we have two different national organizations providing a complementary kind of leadership. One, and perhaps more familiar to you, is the National Farm Animal Care Council, which is a coordinating body with member organizations, over 20 member organizations. It leads the development of codes of practice. It develops the process for animal care assessment programs, and it provides a forum for open discussion of farm animal welfare issues. The council that I'm speaking about in the next slide is the National Farm Animal Health and Welfare Council. This is an advisory body rather than an industry coordinating body. It involves about 13 individuals appointed for experience and expertise, not as representatives of organizations. It evaluates issues on all aspects of animal health and welfare, including antimicrobial resistance, disease surveillance, management of novel diseases, and so on. And it reports to or advises senior levels of government and industry. And the two groups communicate and coordinate very well between them. For example, Jackie Weprook, who is the manager of the National Farm Animal Care Council, sits as a member of the Animal Welfare Working Group on the second council. So I think good complementarity and good coordination between the two. And the next slide, I just put up for the benefit of people to review the different activities that the National Farm Animal Health and Welfare Council has had in farm animal welfare. 2010 to 12, we did a national consultation leading to a document called National Farm Animal Welfare System for Canada with a series of recommendations. 2 years later, 2014, we did a review of animal welfare research. 2015, we commissioned a progress report on the first item, the national system. 2016, we had issued an advisory document on public good research related to animal welfare. Next, we did a national consultation on the management of culled dairy cows. 2018, we issued an advisory document on aligning animal welfare law, and between 2018 and 19, we renewed our national consultation and led to a revised National Farm Animal Welfare System for Canada. I'm just going to put a little more detail into those last two items. Next slide, starting with the topic of animal welfare law in Canada. Next slide, Christy. The animal welfare law in Canada is a patchwork quilt of different instruments and different powers and enforcement arrangements. There are different provincial and territorial laws. The codes of practice are referenced in some provinces but not others. Some federal requirements are referenced in some provinces and not others. Federal-provincial cooperation agreements for enforcement exist in some provinces. And the provinces and territories differ in their enforcement tools, enforcement systems, and even basic definitions such as distress. Next slide. We felt that a greater alignment of animal protection law could, first, lead to efficiencies in enforcement, second, simplify the work of producers, veterinarians, transporters, and others who work in different jurisdictions, and third, maintain the confidence of the public and trading partners that Canada has a coherent system for the protection of animals. And the next slide. Here's I'm going to walk through just a condensed version of the recommendations that we made. First, that provincial and territorial regulations cite the same suite of codes and guides consistently so that the same basic standards of animal care apply throughout the country. Second, that provincial marketing regulations and other programs that license or certify producers incorporate codes in a uniform way. Third, that provinces and territories cite the federal humane slaughter regulations so that these become the standard for both provincially and federally inspected abattoirs. Fourth, that provinces and territories cite the federal transportation of animals regulations so that both provincial and federal officials are enforcing a common set of transport standards rather than different sets. Next slide, Christy. Fifth, that federal, provincial, and territorial governments consider creating enforcement collaboration agreements, as exist in some provinces. Sixth, that provinces and territories consider adopting enforcement tools that authorize immediate action to protect animal welfare, as exist in some provinces. Seventh, that development of new standards be done at a national level to minimize the ad hoc development of jurisdiction-specific standards. And finally, that provinces and territories pursue shared definitions of common terms such as distress, duties of owners, and generally accepted practices. And next slide. The subsequent steps on these matters, the recommendations were presented to federal, provincial, and territorial regulatory assistant deputy ministers of agriculture by teleconference in October of last year. The full report is available on the Council's website, and also on the Council's website there is a detailed comparison of provincial and territorial animal protection law going across the country. I can send that to you, or it's also available on the website if people want the excruciating details of what variation there is between our provinces and territories. Next slide. The second thing, a major preoccupation of the Council over the past year and a half has been revising the document called A National Farm Animal Welfare System for Canada. In this, we identified 5 areas where action is needed, and I'll just walk through those 5 in order. Next slide. A critical element, of course, is leadership and coordination. Our observations were that the continued functioning of the National Farm Animal Care Council is crucial to the farm animal welfare system in Canada. Second, that codes need regular revision, that standards are needed for some sectors and service industries that don't yet have them, and that retail and food service sectors need to remain or become part of the system. So next slide, our recommendations were that all players ensure that the National Farm Animal Care Council has the funding it needs to continue to provide national leadership, and for codes to be updated at least every 10 years. And we're happy to see that the Dairy Code, which was the first of the current series of codes, came out in 2009, and it's being updated this year. Second, to create standards to protect animal welfare in the production of antibiotic-free products where this is applicable in future revisions of the codes of practice. To find feasible means of generating standards for sectors and service industries that lack a code of practice within the National Farm Animal Care Council's well-established process wherever that's possible, and to ensure that retail and food service companies continue to be involved in the National Farm Animal Care Council, and that their purchasing requirements are based on recognized standards rather than ad hoc or company-specific standards. Next slide. Second area of concern is capacity building, where we observed that organizations need well-trained people to lead the issue of farm animal welfare, and that some service industries, such as breeders, feed companies, engineers, animal handlers, are crucial for farm animal welfare, but in some cases aren't well integrated into the system. Next slide are recommendations that organizations that provide leadership in animal welfare, such as the larger national producer organizations, review their needs and secure appropriate training for existing personnel or hire appropriately trained individuals, and that national producer organizations, National Farm Animal Care Council, and regulators involve breeders, feed companies, engineers, animal handlers, and others in addressing animal welfare, because sometimes these groups, crucial as they are not well integrated into the system. Next slide. Under research, our observations were that there are serious inefficiencies because much of the research funding in animal welfare comes in small grants from provincial or other agencies that have different priorities, different procedures, different deadlines, and so on, leading to major duplication in the efforts of the funding organizations. We found very little duplication of the research, a great deal of duplication in the funding of research. Second, that industry-based funding is mostly for short-term research to address immediate and recognized needs, with little support for longer-term and policy-relevant research, and that there's limited research on the human determinants of animal welfare, such as skill, staffing levels, and so on. Next slide, our recommendations were that all sectors use or develop coordinated methods of funding research that will be cost-efficient for the sector and for the researchers. Second, to direct some funding to long-term and policy-relevant research. And third, to fund social science research on the human determinants of animal welfare, such as skill, knowledge, and staffing levels, the values of Canadians so that these are known when standards are developed, research on experience with animal care assessment programs, which are being rolled out in some sectors, and that process really needs to be studied and monitored. And fourth, on the economic implications of animal welfare measures. Next slide. Under the topic of compliance assurance, our observations were that there's a lack of uniformity in animal welfare law and enforcement from province to province, that animal care assessment programs are at different stages of development in the different sectors, and that there are some valuable producer-driven compliance activities, but these exist only in some sectors and provinces. Our recommendations were that the Council of Chief Veterinary Officers provide advice on means of achieving more uniform recognition of the codes of practice, options for aligning transport and slaughter standards, and options for more effective and uniform enforcement of animal transport. Recommended that animal care assessment programs be developed for all sectors using the National Farm Animal Care Council process as much as possible, and it isn't always possible, particularly in some of the sectors with very extensive production. That assessment programs, that experiences of these programs be shared among sectors as these are rolled out so we can learn from each other, and that outcomes of assessment programs be reported. And finally, we asked the National Farm Animal Care Council to take the lead in creating awareness of producer-driven compliance activities that could be extended to other sectors and jurisdictions. Next slide. Finally, under extension and education, our observations were that there are some good educational materials on euthanasia, management of compromised animals, and so on, that are not widely known. Second, that we need educational materials for small-scale urban and hobby producers. And third, there's a lack of public awareness of the systems in progress being made to promote farm animal welfare in Canada. Our recommendations were that high-quality education extension resources on animal welfare and handling be identified by producer and extension organizations and made readily available by our own council through a web page, and we're in the early stages of creating that. that educational materials for small-scale urban and hobby production be developed by a process involving provincial governments, producer organizations, animal welfare organizations, scientists, and municipalities, and that all stakeholders seek ways to communicate the value of Canada's animal welfare system to the broad public audience. Next slide. We identified two particular projects for our own council that we didn't see fitting elsewhere. Two high-level needs that are not currently being met to ensure the involvement of social and medical services in cases of animal neglect and when disaster or disease eradication creates serious problems for producers and animals. And second, to achieve better coordination of players in complex marketing systems where animals go, for example, farm, transport, auction, slaughter. And so in the next slide, our recommendations for ourselves to do, first of all, to lead a consultation on ways of involving medical and social services in cases of breakdown in animal care and in circumstances such as disease outbreaks and disasters. And to achieve this, we have a quote, one welfare working group looking at the welfare of humans and animals as an integrated system. We've had very good representation from groups across the country, and now some recommendations coming from that group. And then secondly, recommending to ourselves to lead a review of animal welfare and biosecurity throughout the marketing process from farm to slaughter. We have done so with cull dairy cows, and we're about to do so at the end of April, 1st of May, in an expert consultation on the marketing of male dairy calves. Next slide, this final slide. Since that meeting, we received some additional suggestions on the proposals. We finalized the document last month, and it now appears, the National Farm Animal Health Welfare System for Canada document, that now appears on our website. And our next task, of course, is to continue to communicate with the organizations that are being asked to act on the recommendations. Thank you.
Thank you very much, Dr. Fraser. There's a great public interest in farmed animal, therefore horse welfare, but there haven't been very good sources of information for the public and the consumers. It's great to see that there's movement and coordination of all of this knowledge and resources that we have in this area. I think this is very much a step in the right direction. Thank you again. Next up, we have Dr. Allison Moore of the Ontario Animal Health Network for an update. Are you available, Dr. Moore? Is Dr. Moore available? *6 to unmute your line.
Yes, I'm here.
I wonder if you could go ahead. Good morning.
Hi.
Good afternoon.
So yes, hi. This will be relatively brief. So just to remind people that the Ontario Animal Health Network is a partnership between the Ontario Ministry of Agriculture, Food and Rural Affairs and the Animal Health Lab at the University of Guelph. And our equine network is composed of 4 practicing veterinarians, a veterinary specialist from the Ontario Veterinary College, and a pathologist from the Animal Health Lab, and myself, who acts as an equine specialist with OMAFRA, as well as an epidemiologist. We meet quarterly and discuss survey results. So we send surveys out to our equine practitioners regarding diseases and conditions that they see through that quarter. And then we meet to discuss those results along with the laboratory testing that occurred during the same time frame, and then sort of put a picture together of disease and conditions that occurred. So it's kind of a after the fact, but we try and make it educational as we move forward. And many of our diseases are seasonal, so we can look at previous year's quarters to see what we were dealing with then, to try and give a heads up for veterinarians going into the next quarter. So this go around, we decided instead of doing a written owner's report, so we normally produce a veterinary report for the vets and an owner report for owners. that have been sort of a written document. So we decided to do a podcast this go around. It's about 10 minutes, and it's a sort of broad coverage of what we discussed on our call. Our podcast can be found at Owen, so that's OAHN.podbean, PODBEAN.com. You can search for Equine, and there's a variety of podcasts that are also available along with this most recent quarterly one. Or you can also go to the website, which is oahn.ca/networks/equine. So I'm not going to go through all of what we discussed because we'd like you to go and listen to it. We touched on a number of things. Usually the quarter, which quarter 4 is October to December, is fairly quiet for most of the veterinarians. So we have sort of recurring things like equine asthma, which comes up seasonally, and we're seeing more horses that are having challenges dealing with treatments. And a lot of that is related somewhat to the weather and the condition of our hay. We also, in that period of time, we tend to see fevers in a number of our yearlings that are bought from sales. Typical infectious disease, upper respiratory tract infections. We often don't necessarily pinpoint what the cause is, but in Ontario, they're usually related to equine rhinitis A virus, influenza, or herpes virus. One of the things that we really wanted to focus on as a learning was abortion. So we had a release from OMAFRA in January on a abortion issue at a private farm, and it was a boarding farm as well. And so one of the things that we see with our EHV1 abortions, so our herpes virus abortions, is that people are bringing their broodmares, their pregnant broodmares, into the barns with other horses. And the broodmares are it's sort of a risk for both. So if the broodmare starts to shed herpes virus and aborts, the placenta and the fetal fluids have a high load of virus in it, and it contaminates the environment, and it puts the other horses that are boarding there at risk as well. And in the one situation, the virus was the neuropathogenic form, which nowadays we're dealing with herpes virus. We don't really identify the strain because both strains can cause the neurological form, but the neuropathic form is more likely to cause neurologic disease. So it does create a bit of anxiety amongst owners of horses that are in those barns. So we do recommend that you don't do that. You keep your broodmare separate from your other horses and keep them in small groups so they can be managed if an infectious disease comes through. Anyway, that's kind of a brief recap. I invite everybody to go have a listen, and you can also peruse on the website at owen.ca our previous reports, owner, and if you're a veterinarian, you can actually sign up to log in, and you can see those veterinary reports. You can also see the reports from the 9 other networks that we have available. And that's about all I have.
Thank you very much for that. And it sounds like a reference to a great podcast resource. And it sounds like there's a wealth of very current and updated information there. That looks to be very interesting. Thank you.
Thanks.
Next up, and we're a little bit ahead of schedule, is the University of Alberta students. I've been asked to have you guys introduce yourselves and talk about your project.
So our group consists of 4 students: Shawnee Lupischek, Sam Sarlaxon, Haley Logan, and myself, Autumn Boakland, from the University of Alberta in Edmonton, Alberta. We're all in our 4th or 5th year of study for our animal science or animal health degrees, and we came into contact with Equestrian Canada as part of our capstone project. Now, the concept of the capstone class is a theme-based course which explores broad areas of animal agriculture and animal health. And then students work in groups with mentors on a project involving experiential learning and skill development related to the field. So students generally work with assigned industry partners on a current problem the industry is focusing on. So for example, we got equine infectious anemia with Equestrian Canada, but some of the other students in this class are exploring small-scale pig production, coexisting with urban wildlife, or awareness and control of BLV within dairy herds. among various other projects. And we were all able to choose which projects we wanted to work on, and then based with our interactions with our industry partners, various projects formed. So our group chose to work with Equestrian Canada on the issue of equine infectious anemia. And then Christy House from Equestrian Canada was our assigned industry mentor. And then after our initial conversation took place with Christy, Dr. Wayne Burwash, Doug Orr, and Dr. Melanie Barham. And there was a consensus after this initial phone call on developing well-rounded education materials on EIA for distribution amongst the equine industry across Canada. So the goal of these resources is to inform horse owners about EIA and the risks it imposes upon the equine industry within Canada, as well as correcting any misconceptions about the EIA that may be present. To obtain a better understanding of equine infectious anemia, we conducted extensive research, both academia and with Dr. Avery Gagnon from the CFIA, who provided us with data on test results. So the researched areas included 2 areas of concern that were highlighted by Equestrian Canada to us, and it was determined that the best way to spread awareness and promote education was to create 2 types of educational resources, which ended up being a poster that provided a general overview of the key points about the disease and its transmission methods, as well as a brochure which would contain more detailed information on topics displayed on the poster and other areas deemed important. All 4 of us conducted literature reviews to obtain some academic research for both the poster and brochure. And then throughout the semester, we kept in contact with Christy, Wayne, and Doug and Melanie on a regular basis through either conference calls or through email. At the beginning of the term, our communication was a little bit limited due to scheduling and other projects we had going on. So our industry representatives provided us guidance and feedback throughout this project, which ended up influencing the end product. And we all shared communication through Trello, in which Christy shared us information and resources that Equestrian Canada already had, along with feedback from previous industry consultations, which helped influence what was included on these materials. So Trello acted as a collaborative tool which allowed all those involved with this project to share and quickly access digital information. And then along with Equestrian Canada, the group collaborated with Dr. Avery Gagnon from the CFIA, who provided us with data regarding the testing of equids and positive cases identified from previous years, ranging from 2009 to 2017. This data helped the group create a better understanding of the disease hotspots and provided evidence to help shape the project.
So as Autumn had mentioned, the information gathered for the use of the poster and brochure was primarily from the CFIA and peer-reviewed scientific journal articles that we found within our literature review. The goal of the poster was to deliver the most important aspects regarding equine infectious anemia to target audience in an eye-catching manner that is quick to read. We have a file that is of the poster. I noticed the quality isn't as great as we have it in our PDF file, but the poster highlights basic areas such as how EIA spread, who can get infected, common vectors, and we also mention the misconception about it being transmitted by mosquitoes, as the primary mode of infection is biting insects, such as horseflies. We also mention things such as incubation period, prevention methods, and that there is no vaccine currently available. We also highlight the importance of testing and common signs and symptoms, as well as demographic areas from the CFIA data that have high occurrences of EIA. We also mention that most cases of equine infectious anemia are chronic and asymptomatic. We also mention in this poster about the cost of testing and how this varies depending on your location within the country, and that you should refer to your local veterinarian if you want more information. So next, the brochure we developed was a supplemental tool to provide further information of the target audience to complement the poster. Information on the brochure included information about the disease, the nature of the disease, and how there's a lack of vaccine. We also highlighted how EIA is spread, further expanding on prevention methods, vectors, incubation period, as well as who can get EIA. Again, importance of testing, signs and symptoms, demographics, and when to test and how often it should be done. We also mentioned here the cost of testing and the CFIA's control program and what happens with positive tests. As well as to round off this brochure, we mentioned good management practices on how to prevent your horses from getting EIA. So after organizing and outlining the poster and brochure, we sent an email to Equestrian Canada to make sure both materials included the desired content they wanted. There was some rearranging of topics and word alliterations, but the majority of the content remained on these projects. Equestrian Canada was able to use these materials for further ways to help promote EIA and disease awareness. As well as after completing the bulk of this project, our group decided to generate a consultant's report. This was just a tool of an in-depth document which contains all the background information we had used. It's a tool we provided them to refer to reports that we got our research from, that it was scientifically backed up. Along with a detailed summary in this consultant's report, we also included the data we used from CFIA, which displays EIA testing results, the number of positive tests in Canada, and where the largest populations of infected animals are located. Figures such as the map that was included in the poster and brochure have also been included in this consultant's report, along with other graphs and stuff that we had generated for our overall project. So from this, we hope that this information can provide Equestrian Canada with some tools to further educate the public on equine infectious anemia, and that we will get more of the Canadian population getting tested and hopefully get a little more control over this disease.
It's Christy here. Great. Thank you, ladies. I wanted to just say on behalf of Equestrian Canada and in regards to our contribution to the project that it was a pleasure to work with you guys, and we are happy with the deliverables that came forward. And like we mentioned to you guys, we will work to finalize them within our graphics department and communications, as well as depending on the future evolution of the proposed revisions to the CFIA control program. These will be an ever-revolving document that we will continue to use in the future. So I would like to say on behalf of my department within EC, as well as I can confidently say on behalf of the Health and Welfare Committee, that we really enjoyed working with you, and thank you for what you contributed, as well as for participating on the call today.
No problem. We thoroughly enjoyed this project and working with you guys as well. It was a nice refresher, I guess, from the typical classes that we normally get. So it was, I don't know, I guess we're all just very happy with how things turned out and are happy that you enjoy them.
No, it's all good. Kirsty, would you like to carry on with Equine Industry Development Committees?
Yeah, sure. So I'm going to just first provide an update that Dr. Nicole Wanamaker of the Chief Veterinary Officer for New Brunswick, she was supposed to attend the call today and then had a conflict, so she provided me an update just to go over on the call about the cases of strangles within New Brunswick. So she said that she had reported recently a case of strangles in a different area of our province, southeastern section of the province. A laboratory case confirmed on March 19th, and now a second case now confirmed March 25th at the same premises. Premises is quarantined along with visitor and service provider restrictions. Animals are being monitored and are all under veterinary care. The previous cases in December have all healed and have no ill effects, and the quarantine on the premises from these cases has been lifted, and repeated, she has in brackets there that repeated swabs were taken as per the American Association of Equine Practitioners guidelines. The January cases are still being monitored. She said that she would look forward to perhaps participating next month and giving us further update on these and any new cases that hopefully don't come about. So other than that, I'm just going to give a brief update from the Equine, the Equestrian Canada Health and Welfare Committee. Our focus right now is working on biosecurity as we come into competition season. So the importance of vaccination, vaccinating schedules, as well as best management practices for preventing disease, either bringing disease to competition or bringing disease home from competition. So we've been working on some posters for different aspects of biosecurity, and most of the content of those posters has been pulled out of the biosecurity standard that has been developed and is available on our website, the National Biosecurity Standard, as well as we are continuing to work on the communications protocol for health alerts. You may or may not have seen that when the Canadian Animal Health Surveillance System reports a disease, or as we call them, health alerts, to the surveillance system, we then report it out through our email lists as well as on social media to get the health alert out. And we have seen growing awareness of those health alerts, as well as them being shared more broadly through social media and access to the website and such things. So as the committee is going ahead with continuing to design a protocol that can help our communications team get the information out as timely as possible, but as well as include some education in there. So when the health alerts go out, there's also supporting education to go with them. We are in the very beginning stages of looking at a animal welfare or equine welfare policy that Equestrian Canada can adapt and develop some policy around. So that is in its first draft phase, and we are going to be focusing on as well this year the development of emergency action plan training for disease outbreak within competition to help our competition organizers develop and implement a biosecurity plan within their competitions. I think that covers it for the Health and Welfare Committee. The Equine Industry Development Committee has a few things on their agenda that they're working on. One, and specifically that's been ongoing and has been something that we've reached out to other different groups and had some focus groups that we are doing an assessment on the different legislation that is out in regards to equines and taxation, and we've sort of narrowed down some key priorities of how we can move ahead with working with government to better support horse farm operators and horse farm breeders in different areas of legislation, both federally and provincially. So we've partnered up with the Canadian Federation of Agriculture to help move some of those initiatives forward. And we will be reaching out to industry for their feedback once we have developed a clear path on that. The other major focus right now is, as you know, we have a federal election coming up, so we will be developing an election plan in order to engage the different candidates and see where and how they're willing to support the equine industry going into the federal election. There's also been the development of some import and export resource fact sheets that will be uploaded to the Equestrian Canada website very shortly that have different links and resources, frequently asked questions, things to be considered when you're importing or exporting horses within and outside of Canada. So I think that those are the major things on both sides of those committees for right now. And as always, if there's something that you would like either committee to take a look at, that can be forwarded to myself at khouse@equestrian.ca or through either one of our co-chairs, which would be Doug Orr or Dr. Melanie Barham. So I think that's it for me, Bettina. And again, if we can hold off questions till the end, I'd be happy to answer any.
Thank you very much, Christy. Christy has to be one of the highest energy people I know, and I guess that is a pretty good indication of the number of projects that she has on the go. Last speaker today is Dr. Cheryl James, who is going to update on the Canadian Animal Health Surveillance System. Dr. James, are you available?
I'm here.
Perfect.
Hi, Cheryl. Can you also just give an overview of the Vector-Borne Disease Clinic we all attended last week or
Sure.
so?
Yeah, thanks. Yeah, so among other things, Christy also attended a two-day workshop that we held in Winnipeg on trying to develop a vector-borne disease network under the Canadian Animal Health Surveillance System, or CAS as we call it. It was certainly an important workshop for the equine industry, given the number of vector-borne diseases that are important for this group. However, it was a very, very big and diverse group that attended, because certainly there's public health issues involved with this, certainly with West Nile virus and equine encephalitis as examples. There was academia, researchers, federal and provincial governments, livestock associations, wildlife, the Canadian Veterinary Medical Association. So there were a lot of different people there, from people who study insects to viruses to industry people and public health people. So it was quite an interesting group. But I think we all agree that there's a lot of opportunity for us to pull together some of the very good work that's happening among many of these different groups, to start pulling it together and start cooperating and collaborating a lot more, so that those limited resources that we have that go to vector-borne disease surveillance can be spread a lot further. So we have, following, well, at the end of the two-day workshop, we had established 4 proposals that people wanted to work on. Number one, establishing a trusted network and developing some rules around sharing information. The second was to develop a more collaborative approach to surveillance and to sampling and various other initiatives, and even things such as people are going out and collecting ticks, and those same ticks might be used by somebody else for some other purpose. So if we can sort of start looking at ways that we can share the samples and information, then it certainly helps to increase our coverage and then cut down expenses. We also want to. They also wanted to connect stakeholders to surveillance data and information, somehow to pull all the information and data that's out there together in one source where everybody would know it's there and would potentially be able to access it to help support their own surveillance needs. And finally, there was a desire to really work on effective communication and engagement with all the partners in vector-borne diseases. So where we are right now is there's a draft report that's been prepared, and just along the core planning team is reviewing it at this point in time, and we'll be sending it out to all of the invitees to the workshop over the next while. Following that, we'll be calling a first meeting of a vector-borne disease network group and start talking about how we're going to tackle some of these proposals that people have put forward. So that's it for the vector-borne disease network. Other issues going on with CAS, just a reminder that we are transitioning from coordination through CFIA and Agriculture and Agri-Food Canada. We're transitioning that coordination to the National Farm Animal Health and Welfare Council. We had been expecting to do that around this time of the year, April 1st, but the Council is still waiting for a response on their funding proposals. They have looking for 4-year funding to support CAS over the next little while. And so once they have that, we will be transitioning a lot of the work over to the Council There will be a new coordinator, so Christy, just to keep in mind, I'll let you know when that happens, and probably that new coordinator might be the one that would give you the update on CAS in future. Along with that transition, we're going to be looking for leads and co-leads from each of the network groups. Up until now, most of the groups have been not really led, but coordinated through the CFIA team here and the Agriculture and Agri-Food Canada team member. That's going to change with the transition, and we'll be looking for the people on the network to step up and take the lead. We'll still provide support either through CFIA or through the council. We'll be providing support in terms of organizing meetings and setting agendas and whatever, but the expectation is that people in the network who have a stake in the network will be the ones that will lead the network groups. So sort of keep that in mind. If there's somebody here that's on the network group that would like to step up and play a leadership role, we would certainly welcome volunteers. Along with the, just to let you know, Keith Murch, who has been working with the Equine Network over the past few years, is going to continue on over the next short while. We're in transition, so there's a lot of uncertainty. So Keith is working 2 days a week, and we have him signed up until the end of June. And his main goal over that time is to get that equine notifiable disease database up and running on the CAS website. We're not really sure what happens after the end of June, so that there's a lot of things sort of up in the air right now with the transition. So I think that's all I had to say. Thank you very much.
Great. Well, thank you everybody for participating. This is just a wonderful opportunity for us to kind of connect coast to coast on what's happening in animal health and specifically in equine health and welfare, and we really appreciate your time dialing in. So with that, we'll close, and we'll talk to you next